Hello, beautiful visionaries, and welcome to the Plant Spirit Summit. I'm your host, Dr. Marie Mbuni, and in this series, we will be exploring the expansion of ancestral medicines around the world through the lens of the ancient condor eagle prophecy. Today, I'm excited to bring you Atira Tan, who is passionate about creating safer spaces for everybody and bringing healing and awareness to the shadowy areas of life. She is currently the head of preparation and integration at Aya Healing Retreats. Atira is the pioneer of the trauma informed plant medicine facilitator, and she is one of the greatest trainers in this area, as I have experienced myself at the Plant Spirit Integration Coach Facilitator training.
Mm.
And she is also the creator of the Somatic Plant Medicine Integration Program. Currently, she imparts her wisdom in training programs with ICRs, the Plant Spirit School, and Inward Bound. And she is the co director of the Somatic Psychedelic Facilitator Certificate with the Embodied Lab. Welcome, Atira Tan. We're so happy to have you here.
Thank you so much, Marie. Yeah, I'm really glad to be here and glad to be connecting with the audience as well today.
Mm. And I want to get right into it. So, the question I have that I'm really curious about is what have you personally witnessed when psychedelic facilitators are not trauma informed or have the qualifications to work with trauma?
Yeah, that's such a great question, Marie, and it's such a great segue into the content of my talk today, which is around navigating complex trauma imprints with our work with psychedelics. So I'd like to just share a little bit of context, perhaps, of what I do. So I'm a somatic trauma specialist and also an educator in this realm of psychedelics and plant medicine. And in my private practice and the work that I do in facilitation, I meet many participants, and I also specialize in offering, trauma recovery sessions using the somatic approach with those who have been re-traumatized from psychedelic experiences. And from my, I think 8-year career working in this field, I have noticed that a lot of these experiences of re-traumatization can be mitigated in a quite an easeful way if psychedelic facilitation or facilitators or guides or medicine coaches or people that work in this realm have the foundational understanding of trauma. Not just that, but how to respond and create safety in all levels, in the set and setting. But also, I think that what's mostly missed in the psychedelic world is the safety that we can create in an interpersonal realm, which means that healing is really based on relationships and that relationships between the participant and the facilitator is really key in offering repair from trauma imprints that are absolutely going to happen during psychedelic experiences. So some of the worst, I think, kind of situations that I've been involved in are folks going into either a brief psychotic episode where a person has to be hospitalized. And definitely, I do not wish that on anyone. There have been also many cases of abuse, exploitation, and manipulation from, perhaps facilitators that perhaps present more on a narcissistic personality disorder presentation. But most of the time, I think that facilitators are ignorant. They come with good intentions, but because they are not qualified to work with trauma or they have their own parts that have been touched by trauma themselves and they haven't worked on that, they tend to project, I think, their beliefs into the psychedelic space that can be easily suggestible. So, folks are really vulnerable, right, in an expanded state of consciousness, in an altered state of consciousness. And when facilitators are not aware, they start to project their own trauma imprints onto other people. They start to project their own, history of neglect, let's say, or history of not being attuned to participants, or perhaps the history and beliefs of spiritual bypassing or dismissing or validating, what the person is going through in the psychedelic experience. So most of the time, what I see is that leads to re-traumatization that presents as high-level anxiety, for instance, high, global anxiety that just does not go away for a long period of time. A lot of people feel that, perhaps they've gone through some kind of ego death experience, but their sense of self wasn't actually strong enough to really integrate, I guess, the death and also the rebirth. So as a result, that they have, they feel so blown wide open without, any kind of protection at all, and they start to feel very, very vulnerable and extremely insecure within themselves. On the physical level, this can show up with a lot of, fatigue, chronic exhaustion, deepening into depression and high anxiety symptoms, and also sometimes emotional flashbacks that stay for a very, very long period of time that has been triggered by the psychedelic experience. So, what I like to share actually and empower the audience today is to give folks tips and tools so that this doesn't actually occur, and that psychedelic facilitators can actually have the awareness, the knowledge, but also kind of the wisdom and the attunement to mitigate such risks. Because I believe that psychedelic experiences are sacred and they need to be held with reverence. And I think that in our kind of, psychedelic world that's moving to its more medicalized model, sometimes the reverence and the sacredness, of this space is not fully, it doesn't really fully land, I think, for facilitators. And there can be a trend of the psychedelic hype where we want to give people more and more experiences. But when we are working with trauma, we need to remember that less is actually more. And to pay attention to certain things like resourcing people and making sure that their nervous system is resilient enough to actually receive the insights or the experiences of the sacred plant medicines is also very, very important as well. So it's not about just giving people all the experiences, stacking experiences on top of each other. It's not about collecting experiences, but when we look at trauma healing, less is definitely more.
So I know that everything you have said is so important because if we lose the sacredness and the reverence, there is a certain element of even groundedness of the
Mm,
experience that is lost. And,
mm.
Atira, I know that you've prepared such a beautiful presentation for the audience, and I would like to invite you to share it with us, if you please.
Absolutely, Maria, I would love to. So today, what I would love to share with the audience today is, sharing with you some tips and tools about navigating this category of trauma called complex trauma, or CPTSD, which is complex post-traumatic stress disorder, with certain elements of the trauma-informed plant medicine paradigm that I pioneered and created, to really equip and empower plant medicine facilitators to be more trauma aware and more trauma sensitive. Yeah, so I like to just, really dive into this lecture here, and a little bit of an overview for our audience today. What I'll be sharing will be about healing trauma with psychedelics. Certain important things that you might need to know. Um, an explanation of what CPTSD is, And also, what is trauma-informed plant medicine facilitation and why is it essential before moving into just sharing some tips and guidelines around how you can start to identify and recognize complex trauma imprints when they arise in altered states, and tips and tools for facilitators so that you can keep your participants safe, those that present with CPTSD. But if you are a CPTSD survivor and you're looking for the right medicine guide to really support you in your healing of complex trauma with psychedelics, there are some tips and tools that I would also like to share as well in our lecture today. So I'll get on with it, Marie. And just a little bit of an overview about psychedelics. For thousands and thousands of years, even before psychedelics became mainstream, they have really a huge, rich history in many indigenous cultures for many different things, a spiritual connection, connection to God, um, rites of passage, and personal healing and collective healing as well. And in our modern day world, research has highlighted psychedelics' potential to heal the body, the mind, the spirit, and the heart. And one of the things that I think psychedelics can be so helpful with is that during the altered state, you know, being on psychedelics can really help to soften the psychological defenses that as a trauma survivor, we've had to protect ourselves from the hurt and the adversity that we've been through. So it's human, every human has psychological defenses in our inner psychic space. And on psychedelics, these, emotional and psychological defenses can soften and can facilitate a lot of release and a connection with what is kind of beyond the trauma imprints or beyond the protection. So this could be emotional release. It could also be a connection to our true self, which is perhaps buried underneath our psychological defenses. It could be a direct connection with, God or with, a higher spirit intelligence, whatever you want to call it. And I think that with many people who are long-term wayfarers on this path, we have experienced some kind of healing with psychedelics. However, it might be a little bit different for survivors of trauma, especially with CPTSD. Psychedelic experiences can be quite overwhelming without proper support and also without the resilience in the nervous system or without being resourced enough. It can actually lead to a lot of triggers and re traumatization and imprints coming up to the forefront. But folks not having the tools, the tips, or the nervous system resilience to digest some of these traumatic experiences that can actually come on pretty swift and very fast and very strong and intensely in psychedelic experiences. So, what I like to really reiterate is that healing trauma involves some kind of remembering of what happened, whether it is implicit memory or explicit memory. And in order to truly kind of transform these traumatic imprints, we need to be able to process and digest the very big, sometimes emotions that arise for us. Maybe, with CPSD, it might be imprints of insecurity with attachment and relationships. It might be fear. It might be shame. So, a person, I think, as facilitators, what we need to understand is that we heal as a community and we really heal in relationship. And your relationship with the participant is one of the biggest kind of external resources that you can offer. And we, as facilitators, are actually supporting a person to remember, to digest, to process, to integrate some of these past experiences and emotions back into a person's wholeness. So, as facilitators, I think one thing that I like to emphasize is that it's not a responsibility to fix anybody. Nobody that comes to us is broken. And we want to kind of focus on this perspective of healing, which is that everybody is whole, right? And we are helping a person to come back deeper into their sense of wholeness rather than to make these imprints go away, because the imprints are part of us. And as we have imprints, we also have what we call the blueprint as well as, in IFS, we call it self energy. And sometimes the imprints can be portals into the blueprint. And so it's not about the imprints going away or releasing, rather, it's about integrating some of these parts that have been split off and disassociated from back into the sense of wholeness. So it's really about building a relationship with some of these parts and some of these experiences of adversity that happen to us. So, again, just to reiterate, survivors of complex trauma are especially vulnerable. And I share that from personal experience because I am also a CPTSD survivor. And I've also, been through a lot of psychedelic experiences and can understand from a deep kind of felt sense level the kind of extent of vulnerability that can come out in these altered states. And without adequate support, what survivors may experience in the psychedelic experience is emotional flashbacks with prolonged periods of distress after psychedelic experiences, which is what I shared with Marie before, which really emphasizes the importance of responsible, and I would add, impeccable integrity in facilitation in facilitators and support workers who are also holding people in aftercare as well. So, for those of you out there who don't actually know what CPTSD is, I'd like to share a little bit more. First of all, CPTSD, complex post traumatic stress disorder, actually currently lacks official recognition in the DSM 5, which is the diagnostic manual that most mental health professionals refer to. And I think that Pete Walker, which is one of the kind of leading writers and authors in CPTSD, shares that if CPTSD was actually recognized as an official, diagnosis, then the DSM-5, which is a huge book, would go down into being a thin paper pamphlet because a lot of the disorders and presentations that are in the DSM-5 really stem from PTSD. And with PTSD, it comes mostly from childhood trauma and highlights the influence of early traumatic experiences that happened, all the way, I would say, from conception into our developmental years. And unlike PTSD, CPTSD emerges from cumulative and prolonged exposure to interpersonal traumas. And it's really in this relational field, traumas that happened in our home environment, like abuse, neglect, domestic violence, where the infant or the child is under high stress and doesn't feel safe in their environment due to either, verbal abuse, contemptuousness through caregivers, or sometimes siblings as well in school, in that environment, and also that they want to kind of escape from their home environment that doesn't feel safe, and sometimes it feels dangerous even. But there's nowhere to kind of go because you're a child. So it starts to create these nervous system imprints of a double bind. So you want to kind of reach out for connection, but you can't because you actually have to protect yourself from, people that are meant to love you and meant to take care of you. So it becomes a very confusing and also insecure felt sense inside that can bring up this felt sense of neuroception or danger, which is cumulative and it stacks on top of each other. So this toxic combination sometimes in the family environment, such as denigration or rage or disgust, perhaps from caretakers or caregivers to a child, really creates what I shared before, this environment of fear and shame. And it really hinders this pureness of connection. And it hinders the sense of feeling like you belong in the world, you belong with your family, and because the child doesn't get the help and support that it needs, it starts to perpetuate the cycle of trauma. With CPTSD, what is important to know as facilitators is that it's caused more by nurture, not by nature. So it's not inherently genetic. And when we are talking about nature, nurture, or in CPTSD is rather the absence of nurture or the lack of nurture. It can also be intergenerational as well. So, sometimes we pass on these patterns of lack of care or abuse or neglect from generation to generation, because each generation doesn't actually have the tips and the tools to heal some of these imprints. CPTSD and this presentation also comes from a failure to complete numerous important developmental tasks. For example, tasks around play or tasks around attunement or, connection to a caregiver. It can be created from experiences of emotional abandonment and neglect. And usually there is some kind of physical, emotional, verbal, psychological, spiritual, and even sexual abuse in the home environment that creates that felt sense of neuroception. And as I mentioned, it is cumulative in nature, it stacks on each other. And because there is a stacking that happens of experiences of adversity that the child cannot digest, it starts to create quite complex inner dynamics and patterns. Patterns both in the nervous system, but also in our inner psychic space. There might be a lot of disassociation or splitting off where the child cannot digest, all the big emotions that are happening as they feel scared of their home environment. And it starts to create some very complex imprints. So that's why it's actually called complex trauma. So especially if you are in a culture and a good habit, actually, and I would say a compulsory for all facilitators is compulsory as part of our sacred responsibility and as part of the reverence that we talked about, Marie, of keeping people safe and really stepping into the sacred role of being a psychedelic facilitator. Screening is one of the most important things that we have to do, and screening really kind of creates that set and setting for us to understand who this person is and how we might what they might need in order to feel safe and whether they are a right fit for the psychedelic experience. So if you're seeing on your form or if you're doing your intake interview session with your the applicant, some of the signs of CPTSD that they might share or write down or that you might see as you're interviewing them are emotional flashbacks. So emotional flashbacks can lead to emotional dysregulation, which includes intense mood swings, emotional outbursts, or emotional numbness. Or perhaps you would notice that a person is responding emotionally disproportionately to a certain situation. This could stretch all the way to involve chronic suicidal preoccupation, self-harm, explosive or very volatile or extremely inhibited anger. Or it could also look like compulsion or compulsive or inhibited sexuality. Emotional flashbacks also happen during the psychedelic experience, and I'll talk a little bit more about that later. Some of the other signs of CPTSD is toxic shame. So there is some kind of fragmentation or distortion in our own perception of ourselves. So this could involve some signs like helplessness, or if you're noticing the presentation of your client, the sense of freeze. There is a lot of blame. There might be a lot of self-guilt or a sense of self-disgust, or also kind of isolation as well. And the toxic shame can create in our inner psychic world this vicious inner and outer critic. And this rules for CPTSD survivors like myself a lot of the inner world. So we might be very harsh towards ourselves, but we can also be very, very harsh on other people as well. And the reason for that is because nowhere feels safe for a CPTSD survivor. And both our inner environment and those on the outside world is one of perpetual danger. Other signs also include self abandonment, like neglect, especially if a person comes from the CPTSD kind of category of neglect. It could also involve neglecting one's needs, ignoring our boundaries, suppressing our emotions, a lack of self compassion and understanding, and also a loss of authenticity as well. It could also look like disassociation, where we are, or perhaps reliving experiences through a ruminative preoccupation with intrusive thoughts or feelings. It's very highly likely that CPTSD survivors experience social anxiety, which leads to withdrawal, disruptions in intimate relationships. And this feeling, this felt sense of mistrust of others and repeated failures at protecting ourselves. A lot of time, if you look at a person's kind of intake form, they will also share somatic symptoms such as autoimmune disorders, chronic pain, chronic fatigue, and other kind of digestive issues because they can't actually digest. It's hard for them to digest their emotions. So our digestion is also very linked to that as well. So without going too much into, the trauma-informed plant medicine facilitation paradigm, I'd like to kind of share that trauma-informed practice really involves understanding how trauma affects the nervous system. And we are also wanting to adapt this understanding with plant medicine participants accordingly. And part of the trauma-informed plant medicine paradigm is that we see people with an individualized approach because everybody is different. Everybody has different strengths, they have different challenges. So we really need to meet the individual and understand who they are on a deep level before really ascertaining, how we can help them or understanding their triggers, understanding their wounds, but also understanding their resources as well. And the first principle in the trauma informed plant medicine paradigm is that every individual in the ceremonial space has experienced some kind of trauma, including ourselves, actually, as facilitators. So we need to kind of come into this space from a place of humility and understanding that as a facilitator, we really want to lead from a place of self energy, self with a capital S. And our blueprint energy, and not to be aware of our parts, our own protective defenses as well, that's in all of us as being human, and not to project some of these parts onto our participants. So we need to really know a comprehensive understanding of trauma effects, coping strategies, and also methods, effective methods to prevent re-traumatization from happening from the phase of preparation all the way into the ceremonial space all the way into integration. And this is what I teach in my trauma informed plant medicine facilitation training. We want to understand that we can start to track participants' experiences in altered states, and they might exhibit with either hyperarousal, where they are activated, or hypoarousal responses, which is when they're disassociated and they go into a freeze. And these nervous system patterns can really impact their experiences both in the altered state and also in everyday life. So it kind of emphasizes the importance of tailorized support, support that really meets the individual where they're at. So trauma-informed plant medicine facilitators, they really prioritize this interpersonal space. So therapeutic presence is the foundation and the ground of being that we start to attune to what can create safety in this interpersonal space, but also in the environment with the set and setting, and also on the emotional and psychological and spiritual levels. And especially with CPTSD survivors, attunement is so important because many of the times, these imprints, we've been through so much isolation and loneliness, which is a big wound, I think, in CPTSD survivors. And when facilitators do not anchor that space of interpersonal safety, it can lead to more arousal or isolation or overwhelm or a re traumatization of these neglect imprints. So, what is really important, I think, especially in the preparation phase and during the ceremony and also in integration, is to really offer resources that feel just right for the participant so that we can enhance a person's resilience to integrate and digest these trauma imprints that do come up. So again, as I kind of shared, our focus in this trauma-informed paradigm is to prevent re-traumatization. That is the big thing that we are really wanting to prevent. And we are really wanting to also emphasize the need for trauma recovery of consistent support and empowerment of the choice and agency of participants. And as I mentioned, this work is really based on wholeness. Is not based on the perspective that a participant is broken and they need to fix us, right? And so therefore we really stay away from giving advice, and we're using this inner directed approach of healing, that we're kind of holding space so that the person's inner teacher can really kind of guide us. This inner healing intelligence, which is in all of us, can actually come more to the forefront. And if a facilitator is not really recognizing that within a participant, it can be really harmful actually for a participant. Yeah. Because in that altered state, people, as I mentioned, are highly suggestible. So we don't want to kind of project our own imprints onto others. We are paying attention to the set and setting, not just physically, but also very much emotionally and interpersonally as well. And when I speak to a lot of people, because trauma is kind of the new black at the moment, there are many people that actually think that being trauma informed is like a checklist, like check. I don't, I refrain from giving advice, check. I don't, um, I do all my preparation checklist, check. Being trauma informed is not actually like that. Trauma informed is actually a state of being, is a ground of being where we embody these trauma informed principles. And that exudes from the space of therapeutic presence when we're with our participants. So it's not just a checklist, it's actually being embodied with some of these principles in our nervous system. So you might ask yourself, how do these imprints show up in psychedelic spaces? How do I know if I'm a facilitator when I'm in, with a person in an altered state? What happens? So what you will notice is that participants will present with implicit memories. So they might not really understand what is going on, but their body and their emotions are kind of going back into a flashback into the past. And they might share with you that they're starting to feel very small or regressing to a younger age. They might be fragile, helpless, that the experience might be too hard, that they can't do it alone, that this experience is too scary. Being seen feels excruciating, vulnerable, and they don't really know how to ask for help. In extreme flashbacks, a person might feel like they're about to die or something bad is going to happen imminently. There might be sensations as well of intense pain, physical pain, usually in the belly, in the hips, in the heart area, or the front of the body. It can show up as mind loops, so thoughts that repeat themselves like a record player, and also freeze and catatonia where they can't actually move. So these are some of the imprints that come up. So if you are a facilitator, here are some tips and tools for mitigating the risk of CPTSD re-traumatization. And we want to start first with preparation. So when you are preparing a client, it's important to offer orientation and preparation sessions so that you can take the time to understand the state of your participant's nervous system. Is it fragile? Is it resilient? Is it resourced? Is it hyper aroused or hypo aroused? You also want to start exploring the intentions driving the participants, reason of why they want to be in the plant medicine ceremony. And from the intention, you can start to understand the person's history and also trauma imprints. And through this session, as you prepare them and orient them, you can get a sense of their inner and outer resourcing or resources and their support systems in daily life. Because if somebody is a CPTSD survivor, they will need a lot of support during the ceremony, but also in integration aftercare as well. You want to start noticing their levels of self awareness and self regulation. And even in the preparation phase, we want to provide them with tips, tools, resources, and psychoeducation about working with emotional flashbacks in altered states. Because with CPTSD survivors, it's hard for us to emotionally regulate. So sometimes we need a lot of support, especially when the emotions are so intense. Emotions of intense fear, intense terror, distress can all come up because that's part of our history. And a lot of the time we have split off from that history and it comes out in psychedelic experiences. For facilitators, in the ceremony, it's important to take time to prepare the set and setting and prioritize a person's safety and well being and to make sure that there is physical safety, emotional safety. And when I say emotional safety, includes facilitating emotional regulation. You have to be an anchor for emotional regulation as well. So your nervous system needs to be in what we call ventral vagal or the socially engaged state. So you need to have a high vagal tone when you're in the seat of a facilitator so that we can provide resources for folks if these emotional flashbacks do come up. We want to create psychological safety. So we want to validate and acknowledge and really understand what the person is going through without to really validate them and to have this sense of, provide them a sense of comfort for the flashbacks that they might be going through. It could also include somatic safety, so using, when appropriate and using informed consent, supported touch work, some somatic cues that you can prepare your client in the beginning of the session. Spiritual safety, really creating that space where they can safely connect to a higher spiritual power without you projecting your own beliefs on spirituality or your religion onto others. And finally, interpersonal safety, which is fostered through co regulation and relationship building. Some other really important tools when the person is going through an emotional, distressing experience or emotional flashback, it's really helpful to have a separate space outside of the group so that the ceremonialist can actually provide individualized care so that some of these emotions can really be heard and felt and if they need to be expressed without actually affecting the rest of the group as well. We need to have really important safety protocols, how a participant can ask for help. What are the protocols when a participant asks for help? What are the few steps that the facilitator and the support person will connect to the person that needs help. We need to find a way to support the participants to be courageous enough to feel, express, and digest their emotions and to invite them not to be alone because isolation and leaving people alone actually is 100% you're going to re-traumatize a person, especially if they come from the imprint and the category of neglect. Some other ceremonial tips is to name the flashback. We name to tame a certain emotion or experience. So by saying, I am in an altered state, I'm having a flashback, I'm here to heal. This is my intention. You can remind the participant, you feel afraid, but you're not in danger. We can provide tools to acknowledge the imprint, that we're present with it, that we're listening to it so that we can unblend from the imprint. We can use tools like connecting the individual to their body, inviting them to soften and settle into the support of gravity and the earth. We can connect them to the breath in the present moment. And very important for CPTSD and working with emotions is about slowing down so that we can start to connect to our bodies and what's inside. They can also invite the participants into another safe and comfortable place where they can be themselves and they can kind of let go without having to take care of the facilitator, the support people, the group. And we can also invite participants to feel the feelings without necessarily reacting to that. So this blending and acknowledging kind of process. And finally, I think that part of healing CPTSD is really to allow people to grieve. So not a lot of facilitators are okay with allowing people to grieve and the expression of grief without wanting to fix it wanting it to go away. So really, doing our own grief work and allowing clients space and time to grieve can be really important. In integration support, psychoeducation about the integration process is important, as well as really, providing education around this integration category of shadow work that I kind of share in my somatic plant medicine integration program. But I think with CPTSD, what is really helpful if are not a trauma specialist yourself, is to refer people out. So to start creating a resource bank that you can start to refer people out to specialists that actually specialize in helping people heal CPTSD. We want to follow up with participants who have had an emotionally dysregulating experience and also offering one on one support, or integration groups or referrals so that those who actually need integration support can receive that. If you are a complex trauma survivor, here are some questions to vet your psychedelic guide to see if the medicine guide is the best person for you. And here I like to also thank and acknowledge Shannon Duncan in his book Coming Full Circle, Using Psychedelics to Heal Trauma, as one of this really, really wonderful resource. So some of the questions to ask is to ask, your facilitator, what qualifies you to work with complex trauma? What kind of education have you had? What kind of apprenticeship? What kind of mentorship qualifies you? And if you notice that your guide is being dismissive of your question or getting defensive, then that's a definite red flag. So if you notice that they're, either sometimes beating around the bush or, they prevent the psychological defenses come up, then that's probably not quite the right person. And this facilitator might need to work on their own trauma imprints before actually holding space for others. Another good question is, how much experience do you have as a psychedelic guide? What kind of experiences have you led and in what settings? What kind of trauma qualifications do you have? And what is a typical journey under your guidance? What does it look like, especially for a complex trauma survivor? And notice if they are also asking you the right questions to ascertain if you are a good fit for them. Yeah. So all of this can support you in your journey of finding someone. So, in our slides that you can download from our conference today, I have highlighted a case study and some reflection questions as well that you can journal down if you're facilitators that will help you to integrate this work. And if you have any questions from this interview, you can feel free to reach me here on some of these platforms. So, I will stop my share here, Marie.
Wow. Thank you so much for really bringing awareness to all the things we need, especially like you said, there's such a big, uh, you know, in trauma is the new black, psychedelics are the new black. And I love the fact that you brought it home. This is a mic drop situation. And I hope that, everybody who's watching has learned something, even if you're a facilitator or you're somebody who's thinking about a psychedelic experience, or maybe you've had one. Everything that Atira shared today is a path to our own healing. And I'm so grateful for that. Thank you for your generosity of time, of knowledge, of wisdom. Atira Tan.
Thank you so much, Maria. It's just been a pleasure to connect with you and to share. And I really hope that this will empower people to have safer experiences on psychedelics because plant medicines can really open us up to deep and profound healing. And the safer we can be, then the more these profound transformation and healing can land for us. And this is my greatest wish for the planet today. So thank you for giving me this opportunity to share some of this. Yeah.
Thank you. Atira Tan, Plant Spirit Summit.